In this video I will tell you about heart disease and how it develops gradually due to factors like poor diet, lack of exercise, and smoking. Early detection through monitoring blood pressure, cholesterol, and glucose, and recognizing symptoms like C. Early intervention and lifestyle changes can significantly improve outcomes and quality of life. Here are 15 early warning signs of heart disease. Chest pain or discomfort, known as angina, this is a classic sign. It may feel like pressure, squeezing, fullness, or pain, often occurring with physical activity or stress.
Shortness of breath. Unexplained shortness of breath or difficulty breathing, especially during activity or while lying down, can indicate heart problems.
Fatigue. Persistent fatigue or extreme tiredness can be a sign, especially if it's sudden or unusual for your level of activity. Swelling. Swelling in the legs, ankles, feet, or abdomen can indicate heart failure due to fluid buildup. Irregular heartbeat. Palpitations or an irregular heartbeat, including rapid or pounding heartbeats, can signal heart disease. Pain in other areas. Pain or discomfort in the arms, back, neck, jaw, or stomach can also be associated with heart disease, especially in women. Dizziness or lightheadedness. Frequent episodes of dizziness or lightheadedness, particularly when standing up or during physical exertion, may be a warning sign. Nausea and vomiting. Feeling nauseous or vomiting without an obvious cause can be linked to heart issues. Cold sweats. Breaking out in a cold sweat without physical exertion or due to mild exertion can be a sign of heart problems. Persistent cough. A persistent cough or wheezing that produces white or pink blood-tinged phlegm can be a sign of heart failure. Difficulty sleeping. Problems like waking up short of breath or needing to sleep propped up on multiple pillows can indicate heart issues. Reduced exercise tolerance. Not being able to exercise as vigorously as you used to, or becoming tired more quickly during physical activity.
High blood pressure. Often symptomless, high blood pressure can lead to heart disease if not managed properly. High cholesterol levels. Elevated levels of LDL cholesterol and low levels of HDL cholesterol increase the risk of heart disease. Diabetes. Poorly managed diabetes increases the risk of heart disease, making blood sugar control crucial. If you experience any of these symptoms, it's important to consult a healthcare provider for a thorough evaluation and appropriate management. Early intervention can help prevent more serious complications. Thanks for watching. If you like video, then subscribe and like for more updated videos.